Basic life support, or BLS, is intended to slow or prevent damage to an unresponsive person until advanced care becomes available. The goals of 2 rescuer BLS training include initiating the chain of survival, learning CPR, and how to use an Automated External Defibrillator, or AED, and how to work within a resuscitation team. When encountering a collapsed person, remember to always check the scene for safety before approaching. Once cleared, one rescuer will check to see if the person is responsive, shaking or tapping their shoulders and loudly asking them if they are okay. If the person is unresponsive, send the second rescuer to activate emergency response and to retrieve an AED. The first rescuer will then simultaneously check for breathing and a carotid pulse for at least 5 seconds and no longer than 10 seconds. If the breathing is not normal, but the person has a pulse, give the person 2 breaths separated 5 to 6 seconds apart and assess their pulse every 2 minutes. Begin CPR if the person has no pulse and is gasping for air or not breathing at all. Start cycles of 30 high-quality chest compressions at a rate of 100 to 120 compressions per minute, followed by 2 breaths 5 to 6 seconds apart, watching the chest to rise. If the person is still unresponsive, an AED can and should be used. Once the second rescuer has returned with a kit, they will prepare the AED for use while the other continues providing CPR. For an adult or child weighing more than 55 pounds, place one pad on the upper right side of the chest above the breast and the other pad a few inches below the left armpit. When prompted, clear your hands and allow the AED to analyze the heart rhythm. This should take up to 15 seconds, and follow the voice prompts. Rescuers can also take this opportunity to switch roles quickly to minimize interruptions and prepare to resume CPR while the AED analyzes the heart rhythm. The rescuers share CPR steps to prevent fatigue and increase the survival probability of the person by quickly switching roles after 5 cycles with minimal interruptions. 1 complete cycle for adults includes 30 chest compressions followed by 2 breaths. If a shockable rhythm is present, the AED will prompt you to press the shock button to deliver a shock. Remember to clear your hands and ensure that neither rescuers touch the person while the AED delivers the shock. Once the shock has been delivered, immediately resume CPR for 2 minutes. Continue the steps until EMS arrives or the person's condition normalizes. If there is no shockable rhythm, immediately resume CPR for 2 minutes and then assess again. Continue the steps until EMS arrives or the person's condition normalizes. During 2 rescuers CPR, the team will provide ventilation using a bag mask placed over the person's nose and mouth. Place the mask on the face and create a seal. Form a C shape with one side of the mask using one hand's thumb and index finger and press firmly. The other fingers gently lift the chin to open the airway. Press the mask firmly while squeezing the bag to deliver the breaths, watching for the rise and fall of the chest. Continue the cycles until EMS arrives or the person's condition normalizes.
If you enjoyed this video and would like to learn more, check out our MedicalProCerts video library on YouTube, or if you would like to certify in ACLS, BLS, PALS, or CPR, simply register and certify online today at www.medicalprocerts.com.